Thank you very much for your for the kind introduction. And it's my honor to give my speech in this precious conference. And I'd like to deliver the message of legal and ethical challenges of AI machine learning based diagnosis and treatments in contemporary medicine. In every day, we use AI machine learning technology not only on the web, but already also in our daily living. And in the hospital, even though the hospital does not provide the AI machine learning tool formally to all medical staffs or medical doctors, more than 70 or even 80% of medical doctors use this machine learning and large language model to be advised or to be helped by during their daily practices. So what can we expect from the machine learning technologies in modern medicine? For example, when medical doctors review their daily X-ray or CT or MRI data, there's so many figures in the medical images. So even though the experts review those images, sometimes human can make error or can make some point to be missed during reading. So machine learning technology can help medical doctors to avoid those unwanted error. And this kind of help from machine learning technology can facilitate the diagnosis and treatment in daily practices. However, there are profound ethical and legal questions. So patients usually expect AI and machine learning technologies such as accuracy of their diagnosis and the transparency of their diagnosis process or treatment processes. Whenever I delivered a lecture for my students, I emphasized that the patients are impatient because they are sick, they are in pain, so they are always in a hurry to be treated properly. However, patients do not have enough knowledge, so always the patients and the patient relatives and family members are worrying about the quality of the medical service. So if the patient cannot be treated in fast manner, then always patient or patient family members are asking questions that if they're properly cared or properly treated. So this kind of point, the patient gets some information from the AI and machine learning technologies, including large language model. And also the medical doctors, physicians, they would like to get a sort of second opinion or a sort of safeguard during their daily practice. They have outstanding colleagues. However, those outstanding colleagues are not always available because all medical doctors and staffs are very busy. So if they have some points indeterminate to find the proper direction for the patient treatment, they are even in my case, I would like to discuss some points with my colleagues. However, if my colleagues are not available, then in these days, I'm looking up the recent journals, but also utilize the large language model to fastly review the recently released journals. So during this practices, if there is any error made by AI or machine learning system, then who is responsible for this error? the physicians using LLM, or if the LLM model or AI machine learning model is subscribed by the hospital, then the hospital administrator who decided the subscription of that service is responsible for that error, or algorithm developer of that software or the machine learning algorithm. The current legal framework does not define this kind of new area of the legal or the liability challenges. And even patients, when the patient would like to visit hospital, they should make a reservation. However, in many places, the reservation usually takes several days and even several weeks or several months. So before going to the hospital, the patient would like to get some information about their condition. So in these days, not only Google, but also Amazon or any such a big web player or data providers would provide the basic method or the basic tools for helping those questions. And almost every large language model provides such medical decision supports for the patient's question. And if there is inappropriate answer, then the patient is the patient have an ability to identify if that information is wrong or right. It is very hard to decide whether those it is very hard for patient whether those advices should be followed or not. So in that case, the large language model will be responsible for the liability. And if the patients follow the wrong advice provided by large language model, and if the patient missed the time slot for the appropriate treatment, then is that a patient's misfortune or the patient's misdecision, wrong decision, or is that the LLM who is responsible for those delay? Nobody knows, and nobody can answer until now. And also there's technical challenges like the data bias. All large language model is a sort of mathematical model. So if there is an inappropriate data set used for the training of the large language model, then those kind of contamination with an inappropriate or inaccurate data set cannot be removed easily. And if the large language model is trained with those kind of inappropriate data set, then that language model will continuously provide an inappropriate advice. That is a really big problem. And also, according to the population, ethnicity, the disease, and the pattern and the progression of the disease condition is very much different. However, in large language model, until now, such an ethnic difference is not well reflected. So, if, for example, if the Korean ask their condition to American large language model, then the American large language model will provide the information according to the American patient's condition. And also, if such a wrongful training is already established, then should that large language model be discarded? Nobody can decide such a thing. And that is why always the human factor or human operation is always needed to utilize a large language model as a decision support system. And when providing our data to the large language model, that is an issue of the security of our own data. So all large language model or the AI or machine learning utilized in the field of medicine, and those technologies should be under the control, authoritative standards, worldwide standard, and also the country-wide standards. So, in my opinion, there are three key requirements which for the all AI or machine learning technology to be used in the medical field. The first one is explainability. All algorithms should be explained in medical with a background of medical knowledge, and all patient data should be protected strictly. And the last one is all the data storage should be securely stored and securely controlled by secured allocation. And with proper safeguards, all machine learning technology will facilitate the medical technology much better way. So I'd like to show some example. And even in every operation theater of the hospital, we use this kind of machine, and this kind of machine control the operation condition in optimized manner with a machine learning technology already used, which is already widely used in daily operation room. And even though it is not large language based model, but it is machine learning based model, and this kind of technology is also used for the robotic surgery, and all the robotic surgery handles are trained already with a machine learning technology. And this kind of robotic surgery can facilitate the patient recovery after the surgery. And in case of Seoul National University Hospital, we have huge amount of data. For example, we have 3.3 petabyte of data of more than 88.8 million patients. And those data are really precious data set for training the machine learning based decision support system. And in conclusion, during developing the machine learning technology and utilizing the machine learning technology in daily medical practice, always we should remember that protect humanity is the main goal and also main issue we should not forget during our daily practice. And with this firm background, we can keep on innovating medical technology, and we can provide better medical service for every patient. Thank you very much.